with me today, I got our experts from customer support, Anna and Jörgen on link here from Hudiksvall. So please welcome to this studio. How are you today? How are you, Anna?
I'm good. It's been a very exciting day and I can't wait to see the questions.
And how about you, Jörgen? Are you having your really full time answering a lot of questions?
Yeah, it's been quite busy here in customer support. I can't know really if you can hear me. I'm hearing you barely, and it looks like the picture froze from where I'm standing. But yes, it's been very busy today.
Yeah, a busy day. That sounds great. And now we will answer some of those questions that will maybe ease the emails going to customer support as well. So I think that we will start off directly because we got lots of questions from you viewers today. So let's get started. What is reflux, Anna?
Well, reflux is actually when you get your stomach acid coming up from your stomach up to your esophagus and maybe sometimes all the way up to your mouth. And the stomach acid should only be in the stomach so you can digest the food. It's a very it has a lot of acid and can do a lot of damage coming up. So when you get reflux, it's most likely that you do have a hiatus hernia, which is actually a weak inner musculature, and you have to strengthen that musculature so the diaphragm is able to keep your LES and your stomach in place below it, where it always should be.
Yeah, great answer. And Jörgen, would you mind showing whereabouts are the diaphragm on your body?
Well, I don't know if you can see me actually, but it sits below the sternum and it follows the rib cage all around and attaches back in the back. So it's a very thin muscle, but it's very big and it covers a big area, and it also separates the stomach from the heart and the lungs.
So big and but quite thin, right? And is it around here?
I can't see you at all, so I do not know.
Okay, you can't see me at all. Okay.
So yeah. I will say yes, it is. Yeah. It is around that area, yes.
Yes. So what kind of symptoms do you get when you have hiatal hernia causing reflux? What kind of symptoms can you also have besides reflux?
You can actually get a number of symptoms. You can have a dry cough, for example, and that's the acid coming up in tiny, tiny particles and irritating your windpipe and your vocal cords, for example. So dry cough is quite common. And also the cough where you get this thick mucus coming up. And that is actually your esophagus trying to protect itself from the acid coming up. So it's quite clever, the body. It's a very annoying symptom, but it's quite clever that the body is trying to protect itself. You can get a hoarse voice, for example. You can get food stuck in your throat. You can have difficulty swallowing certain foods, and most of the time it's foods like rice, dry white bread, or chicken, for example. So there's a number of symptoms, and you don't have to have all of them to have a hiatus hernia. You can actually only have one, but it could be most bothering anyway. So there are a lot of symptoms.
So you can have a lot of symptoms. So you don't even need to have reflux, but you can have hernia.
Absolutely.
Doing the same or being the same root cause.
And this globus feeling as well is very common, and that could be very annoying if you try to eat and it feels like you can't swallow your food. Yeah. So that could be actually a big problem.
Yeah, I reckon. And since we got so many questions from our viewers, I think we hit off those questions here. So just a minute. Sorry, I was logged out here. So We got this question from Sheila Chapman. How do I watch the Instagram lecture? That was the first I worked with. That was not this sort of a question. But yeah, that's available later on our webpage, IQoro.com. So you find that information there. But we have another one. I have found that allergies can also trigger reflux. How common do you think this is?
Do you want to answer that one, Jörgen?
I'm having trouble hearing you.
Okay, sorry.
So Anna, please.
Yeah, can you repeat it?
Yes, it's I have found allergies can also trigger reflux. How common do you think this is?
Well, since we're not medically trained in that way, I don't feel really comfortable answering that question. So I would suggest that you speak to a GP or a consultant about that.
Yeah, sounds good. Is it normal to have bad breath as a hiatal hernia symptom? Can IQoro fix it?
Well, a bad breath comes from that the acid is coming up. The acid is very strong. If you've ever had a stomach bug, for example, and you throw up, you know that you get a really bad taste in your mouth. And of course, if it comes up in small portions all the time, it will cause a bad breath as well. So training with IQoro is brilliant because you will strengthen your inner musculature and you will keep the acid in your stomach.
And in that way, not having a bad breath.
Not having a bad breath, exactly.
So you could kiss your husband or wife down
yes.
at home there
Absolutely.
afterwards. Okay, that sounds comforting. So next question. Is IQoro available on prescription in the UK? Both my GP and the consultant didn't know anything about it.
Well, yes, it is available on prescription for acid reflux or dysphagia. But we are constantly trying to educate all healthcare professionals in the UK and all of Europe about IQoro and the benefits, but it's really hard to reach out to everybody. So we find that if you as a patient see your GP and ask them about IQoro, they will hopefully get an interest to visit our website or call us or just let us explain about IQoro and the benefits. So we're working really, really hard, but we know that there's a lot of GPs and consultants they don't know about IQoro yet. And we're fairly new to the market as well. So, and it's an innovation. So there's nothing like it.
Yeah. So if a GP or has the questions about IQoro and how they would treat like reflux, can they call our customer support?
Absolutely, absolutely. We're here for everybody. Before you buy IQoro, after you've bought IQoro, and for all practitioners as well, because we're more than happy to talk about IQoro and answer all the questions. So absolutely, everybody's welcome to contact us.
Thank you. And I see that we lost Jörgen, but we continue. I'm happy to have you in the studio, not having the struggle with the live casting. I've just bought the IQoro for hiatus hernia. Can you please explain how to use it?
Of course. Or maybe you should explain and I can show.
Sure, we can do it in that way as well.
Okay.
Turn around the roles a little bit, but it's all right.
Okay.
I'm in for the challenge.
Okay, so you
start
explaining.
So Anna will show us how she trains with IQoro, and what she does is that first, of course, she has a straight position of her body, no crossed legs, and then she will put the IQoro in or insert the IQoro in front of her teeth and pressure the lips tightly together. And now she is in there, and then she pressures the lips tightly together and pull slightly outwards from the gums, so it doesn't have a friction there. And then she pulls in a steady grip forward for 5 to 10 seconds. So she counts now to 1 and 2 and 3 and 4 and 5, and that's at beginner level. And then she rests. And when she did that, she held her breath.
Yes, you should, as Linn said, press your lips tightly together and then pull IQoro just a tiny bit out from your gums so you won't get any sore gums. And then it's your lip that is supposed to be the resisting part. You should not pull very hard. You should hold your breath and making sure that the lips stay in the same position all the way throughout the session. So the first pull, the second, and the third.
Yeah.
So you shouldn't lose the grip of IQoro. If you do, the exercise will not be as efficient.
So what can you do? Because can you show if it's if you have, because it's quite common that you are weak in the lip musculature if you have reflux, and probably you haven't experienced that before you start to train with IQoro, but it actually has a connection, as this muscle just has given up and all the other muscles are working extra hard. So can you show how it looks like when you don't get the tight grip around the handle with your lips, and how it shouldn't look like when you train? So now she's pulling forward, and she gets this gap in between the lips. Can you show it even more? If it's really weak, it just slides apart like that. Do you see? And that's very common. So what do you do then, Anna? Do you have a special grip or something to help out yourself with the lips?
Yes. If you have very weak lips, you can use your other hand, like a V sign, and you hold your lips with the other hand, so it looks like this.
So she grips with these scissors of her hands and fingers, and then she holds it, and that makes it tight. And still, you need to pressure your lips tightly together, almost like when you do the M sound.
Yeah, we tend to explain it like you do the M sign, or that if you have ever had children, try to spoon feed them with something they don't want to eat. So that's how hard you should press your lips together.
Yeah. And is it important to pressure the lips together, or?
Yes, it is. It's very important. It's more important than how hard you pull, because if you pull too hard, you can actually overtrain, or your muscle will become tired, and you can't benefit from the training.
Too fast.
Yeah. So it's important, pressing your lips together, and it should be a firm pull, but not too hard. We have children training with IQoro, and if you're 4 or 5 years old, you're not as strong as an adult. So it doesn't take a lot of force.
No, exactly. So we move forward to the next question here from Phyllis Brackenbury. I've been using IQoro for 4 months, and the symptoms have got worse recently. Sore throat, lump in the throat, and discomfort in chest and diaphragm. Is this usual?
Yes. This is a long-term solution to a problem, and it doesn't cure overnight. So this is more or less in the beginning of the training. And it's very common that you get worsening symptoms or different symptoms. So it will pass. It's not dangerous, but you can make sure that you are performing the exercise correctly. That is actually one way. And the reason why you get these different or worsening symptoms is that your body needs to get used to this new training. Imagine you go running for the first time. You get some, muscle ache, and maybe you get a sore knee or a sore hip. But the more you do this exercise, the body will get used to it. Yeah. So it's not dangerous at all.
Could it also be if they are lowering, if they are having PPIs, for example,
of course.
having some antacid medicines and then suddenly quit?
Yes.
Then it also could be an experience of worsening symptoms. So,
absolutely.
So what's the recommendation there?
Well, if you are on PPIs when you start your exercise with IQoro, you should stay on your PPIs as you normally would. And after about 3 months, around 3 months, you can contact your prescribing doctor and tell them that you want to phase out the medication, because you should phase this medication out slowly. If you quit from one day to another, you will get a rebound effect, and it's very, very, it's unpleasant. It's
we talked about that earlier as well, and the importance of taking that slow, and also have the discussion with your doctor or prescribing doctor before you lower the dosage. I'm so happy that Jörgen are back with us again. Welcome back.
Thank you. Some technical difficulties, but that's how it is when you have a live session.
Exactly. You need to count on that. So I think the next question is for you, Jörgen. My worst symptoms are post-nasal drip and constant throat clearing, which affects my singing voice. Can IQoro help?
Yeah, that's the post-nasal drip and the constant throat clearing often comes hand in hand. And yes, IQoro is very suitable. And I can understand that it affects the singing voice as well. And like we said in the earlier Q&A, when stomach acid is allowed back up, all the way up in the esophagus and down in the windpipe, it can actually affect the vocal cords. So by training with IQoro to prevent stomach acid from coming back up and affecting the vocal cords, you can get a stronger voice, and you don't have the need to clear your throat anymore.
That sounds great and comforting. So then we pop over to the next question. I have treated myself 2 months, 3 times a day with IQoro, and I can see. I think I can see any result. Some question: can I use IQoro more than 3 times a day? I think it should be standing. I can't see any results. So the question is: can I use IQoro more than 3 times a day to get results quickly?
No. You should not. You should never exceed the recommended 3 times 10 seconds, 3 times a day. If you do, you will overtrain your muscles, and overtrained muscles, they can't benefit from the training, and you will get little to no effect. So always stick to the recommended. This is not a workout at the gym. You're not supposed to break a sweat. So always the recommended 3 times 10 seconds, 3 times a day.
Great, thank you for that, Anna. Question here from Leslie Winston. Why does a hiatal hernia make you feel that you have a lump in the throat, and why has mine got smaller, please? Jörgen, would you like to answer that question, please?
Yeah. Well, when you have a hiatal hernia, it means that the top part of your stomach is sliding through the diaphragm. When this happens, your esophagus sort of becomes too long. It doesn't have the correct length, and it might crinkle up, like the bendable end of a straw or an accordion, if you like to exaggerate things. And when this happens, you can actually feel the lump in the throat sensation, and you also have an upper sphincter sitting right about somewhere here. So many say that they feel the sensation of food getting stuck, or like they have something constant blocking there. So it doesn't matter how often they make a swallow or if they drink a sip of water, it's still there. So the answer to Leslie is well done with your training. The training is a result why the feeling of a lump stuck in your throat has gone less noticeable.
So does that mean that the stomach is in the position more often underneath the diaphragm again?
Yeah. So as like you say, Linn, and when this happens, the esophagus itself becomes like a straight pipe again, and hence the feeling of not experiencing the lump in the throat.
That sounds great. Thank you, Jörgen. So how do now let's see here. I have now I'm going to say what is it? I have an L hemidiaphragm paralyzed. Will this impact my IQoro training? I also am very short of breath. Is this a symptom of reflux?
Well, if I'm not sure what the hemidiaphragm means, but
maybe you could
if
check
there
it out, the crew here.
Huh?
Maybe the crew here could just check it out and pop
absolutely.
it in.
But
Dialogue.
if Doreen means that her diaphragm is somewhat paralyzed, she might actually suffer shortness of breath, and the reason to why she is suffering from shortness of breath might be that the top part of the stomach has gone through the diaphragm, and it's up and it's stealing space from her lungs. And that's also why people can sometimes experience a real intense pain behind the sternum in the chest, and many people have seek the emergency care for this, and by all right you should do that if you are having troubles or pain in your chest area. But what they get to hear is that, okay, we have done, or we examined you, everything looks good and in order. But again, when above the diaphragm, it should be the heart and the lungs, that's their space. The stomach should be below. So if she suffers from shortness of breath, it might be actually that the top part of the stomach is there and stealing space. So many people are also wrongly diagnosed with having asthma because they're having trouble taking deep breaths. That's very common. We hear that every now and then. And it's the same reason really.
But the main thing is that it gets too crowded here.
Yeah, it's too crowded.
It squeezes away the lungs and the heart, for example. So yeah, that's very interesting to hear. So thank you, Jörgen, for that. Scotland, can IQoro take a long time to work? Hunter, Scotland, can IQoro take a long time to work, Anna?
Yes, this is, as I said, it's not a quick fix, because you're exercising your muscles, both your voluntary and your involuntary muscles. And if you go to the gym and work out, you won't have like Popeye biceps or triceps in 2 weeks' time.
Okay.
So you have to be patient, and we say that the average time to notice positive results in your symptoms is actually 10 to 12 weeks. So, and for some people it might be a bit shorter, and for some people it might be a bit longer. But we do know that if you do the exercise correctly, that after 6, 7, 8 months, you could expect a similar results as in the studies. But this is an average time.
Yeah.
Well, the studies actually show that 97% of all people using IQoro are being helped. So, that's a high number. That's a really high number.
Yeah.
But you have to stay persistent. Don't give up. Use the app as a reminder. Use the app to keep track of your seconds. So use all the tools and use customer support as well.
Yeah, as Jonathan, the NHL player, and hockey player, said earlier, it was a huge importance for him to use the customer support and talking to Jörgen when he was feeling doubtful about how it worked and what was happening.
For a long time as well, before he saw some results, but he did.
Yeah.
So he didn't give up, and that's really important as well.
Yeah. So even if you train for a long time, we know that you have an effect.
Yes. It will have an effect.
And if you haven't reached the full potential of, or the full, what your aims are with the training to release symptoms or get rid of them, you just continue to train more than 6 to 8 months, right?
Yes, you just keep up the training. And when you reach a good result, as good as you can get, you can start maintenance training, and that means that you could either do 2 sessions a day, 1 session a day. That's very individual, but you can lower the sessions so you don't have to exercise as much, just to maintain the strength that you've built up.
Yeah. And that's because it's muscular.
It's muscular.
Muscular problem.
Yeah.
Thank you, Anna. Amanda, doctors always say that reflux is worst after eating, but I feel liquid coming up into my throat only when my stomach is empty. Eating sometimes make it stop. Do you have any idea why? Anna, or Jörgen, you're on it.
All right, you go ahead if you like to. Otherwise, I was just going to say that, some people can actually experience acid reflux, even on an empty stomach. And what is happening when Amanda is having a snack? Well, the stomach acid gets busy with the food. So in that case, it could give a temporary relief, but it's not uncommon that it comes back again and again. But so you can have acid reflux even on an empty stomach. We also do know that many get the recommendations to eat small portions of food and eat more often instead, as a way of relieving it. But it could as well be, that you're on an empty stomach and the reflux hits like a lightning.
Thank you, Jörgen. Why and how does reflux cause a post-nasal drip? Anna, would you take this one then?
Well, I would actually give it to Jörgen, because Jörgen, he's the real expert on post-nasal drip.
All right. Jörgen, over to you.
Yeah. All right. Yeah. So some people, they actually have, the only symptom could be post-nasal drip. And many people can experience a bad taste in their mouth as a result of stomach acid coming up in your oral cavity. And if it continues back up in your sinuses and up in the, at the top part here, it could cause post-nasal drip as it is acidic. And the very fine membranes that you have in the sinuses, they get affected, as well as the vocal cords or the lining of the esophagus. So as a result, you will have post-nasal drip when this occurs.
Thank you so much, Jörgen, for your answer there. Let's go to the next question. Am I too old for IQoro to help me?
There's no upper age for IQoro. And you could be as young as just 12 months old to start IQoro training, but there's no upper limit. You can always benefit from exercising your muscles, always. And a lot of times you get these problems when you get older because your muscles will become weaker. Your arms, your legs, you can't lift as much as you used to, and that applies to all muscles actually. So no, there's no upper age.
So could it even be good if you don't have reflux in the today or other symptoms? Could it be good to use IQoro in a preventative
Yes, absolutely. People go to the gym to not get the problems when they get older. So why couldn't you train your inner musculature as well? So absolutely.
Interesting. Thank you, Anna. Margaret Taylor, is IQoro a permanent solution?
I would say yes. If IQoro is used for a symptom that IQoro can treat, and we do know what it can treat, but it depends on what Margaret is suffering from. But we could guess that it might be a reflux, given the theme of this day. So if so, like Anna said earlier, once you have achieved positive results, you should not stop training, because when the muscles stop getting stimulation, they go back to the condition they were in before you strengthen them. So it is a permanent solution, but you will need maintenance training. Like just because I'm brushing my teeth today doesn't mean I have to do it tomorrow to prevent it from getting some holes or damages on my teeth. So the same goes with IQoro.
Thank you. And then we got one more question here, if it's possible to rewatch popular parts of this event, and that the question to that is, of course you can. It will be available directly after we are done with this broadcast today. And now we got another question here. Is reflux dangerous?
Yes, it could be. If you have reflux for a very long time, the stomach acid will damage your esophagus, and if you suffer for a very long time, it could it could, it could get to like a Barrett's esophagus, and then you could actually get cancer. But that's if you have it for a very, very long time. But you could also get these damages on your esophagus, making you cough up some blood maybe, because these tiny, tiny vessels. So yes, it is absolutely, it is dangerous. And if it comes up to your mouth, you'll get bad teeth, so yes, it is actually.
And that leads me to another question about the area. If you had recently a reflux, can you brush your teeth afterwards without damaging the teeth?
Well, what do you want me to say to that?
Maybe I put you on something. No, well, I can just share a tip there, which is a good tip. If you have recently refluxed, you will have an acid in your mouth, affecting your teeth. Yeah. So afterwards, you could actually use like something to like only flush your teeth or drink some water, but do not brush your teeth because it will damage
the same as with lemons. Yeah, you get this acid.
Yeah, exactly. So that's just a tip. Sorry for for that. But and then I got another question, because we have this discount code for only today.
Yes, we do.
Yeah. So what code is it again, Anna?
So you use the code Reflux 2023, and please remember to apply the coupon in the checkout.
That's great, and it will be working the whole day until midnight today. Until midnight. So you got time until then. I have had acid reflux, but the gastroscopy showed that I do not have any hiatal hernia. How is that possible?
Well, to be able to see the hernia, the stomach and the lower esophageal sphincter actually have to be positioned above the diaphragm in the exact same moment as the examination is taking place. If it's not, and it's below the diaphragm where it always should be, they will see that you have a diaphragm, but they can never see how strong it is, if it is able to keep it in place at all times. So the most common hernia is actually the sliding one, and that means that it slides uncontrollably. So
up and down through this hole in the diaphragm.
You could say that if you're lucky, they will detect it, because then you can get, you get some answers to why you're feeling poorly. But if they don't see it and they say, well, we don't see anything wrong with you, it doesn't mean that you don't have a hiatal hernia.
So it's very important to listen to the symptoms that the patient or the person has.
Yes.
Yeah.
Yeah, and actually acid reflux means that stomach acid is allowed back up in the esophagus. That's the meaning of the word. So if you have acid reflux, you have a weak diaphragm, but it might not always show.
Great, thank you for that, Jörgen. Can I cure reflux with medicine?
You can give some relief, definitely. And sometimes a short treatment, a period of treatment might actually be real good. But to date, I do not know of any drug or home remedy that can actually strengthen weak muscles. So to strengthen them, you will need to train. But medicine, home remedies can definitely give you or offer you some relief from your symptoms, but it will not address the root cause.
Thank you, Jörgen. And that was, as Peter talked about earlier this day as well, that they thought that you shouldn't be on long term for PPIs, and they were really, what do you say? They agreed upon that, that it was important. It was very good in the short-term perspective. Can I cure or fix the feeling of a lump in the throat?
Absolutely, because that is one of all symptoms of a hiatus hernia. So of course you can. So all the symptoms we've mentioned, IQoro is brilliant It's actually, it is what can strengthen your musculature. As Jörgen said, there is no pill, there's no drug that can help you with this. You can get a short-term relief, but in the long run, you have to strengthen your musculature.
Thank you, Anna. And that will actually be the last question of today's Q&As. And if you haven't got your answer today, please write the question to our customer support at info@iqoro.com, and they will answer your question, perhaps also in more depth. So what's going on for the next here? I would just want to thank you both, Anna and Jörgen, for joining us here today, live here in the studio and by link, Jörgen. It's been really nice having you here.